Hello and welcome to Thursday Zoom coding class. So tell me, how are you guys doing with your coding? How do you like it so far?
It's good.
You're
I like it.
doing great, Chase.
Sometimes I second guess
answer?
myself.
You want an honest answer? Some of these are confusing.
Yeah, definitely.
So tell me, what's confusing about this? Knowing which one goes first or?
No, well, kind of, because on one of the tests, I missed one, and then I went back in the book and it said they could either be labeled first or second. So the order didn't matter, but the question was wrong because the order was off. So
Which
it's not.
exam was that?
I have it written down at the house, but currently, the one that comes to mind for confusion was the one on the exercises I did last night, the labs for yesterday. It had to do with diabetes of the foot and cancer, and it listed 3, but I could only discern 2. So when I went into the appendix and saw what it was, I kicked myself, but there's no indication that there was one or the other instead of just a 1. So I coded it as 1, and they were supposed to be 2.
Okay, well, let's go through our lesson today and see if this sheds any light on things and kind of helps you start getting built up with it. And but I do want to say, before I get into that, I don't want to forget, I am on vacation next week. So I am going to be putting Miss Danielle Washington's name in my news and announcements so that you can reach out to her. I'm probably just going to give email address, and she may say, hey, call me at this number. But Chase and Jenny, can I give y'all's number out too, so that if anybody needs help student-wise?
For sure.
Jenny, you can say, okay, it's okay. All right. So that way I'll have other fellow classmates that can help them out. I'm going somewhere this weekend. We're going to a NASCAR race. I'll be back on Monday, and we may be taking a trip to Georgia. I don't know yet, to visit family. But I'll still be available by text, but I don't want to answer a lot of texts. I need some time off. So, but if there's something going on or something's pretty major, just let me know. If not, write it down, and when I get back, we'll deal with it afterwards. Here comes our Melinda. I was wondering where she was. Melinda, do you have your ICD-10 code, ICD-10 ready?
I'm gonna go get it ready.
Okay. Chase, what are you eating?
Beef jerky.
That's what I thought it was. That's what y'all want to know what I had for lunch? A fish fillet sandwich from McDonald's. It is like,
That sounds tasty.
that's my favorite little sandwich from, a to-go. I don't know why, because it's not good, but I love it.
My mom loves that. I kind of like it.
Yeah, I love it. All right, so if you're all ready, we're going to go ahead and get going on our coding. So the first one that we're going to look at is arthritis due to Lyme disease. So when you look at this, what automatically comes to mind would be the key term.
Arthritis.
Disease. I'm telling you, if it has disease in it, you're usually going to need to go to disease. So what we're going to do is we're going to go to the index to disease. Then once you find disease, go to Lyme, and then check to see if you got the same thing I got. Now, please note, I'm going step by step in a few of them just to give some of our newer students a little bit more instruction, but we are going to be coding some on our own. So it won't be, I won't be basically giving you the answers before we all decide.
It's A69.20.
Right, so that's what I have, A69.20. So now we're going to go to our tabular and look at A69.20. And I'm actually going to go there myself.
Says Lyme disease unspecified.
But is it specified?
Yeah.
It is. So we can't, let's not stop there then. A69.20 says Lyme disease unspecified. We know that that can't be right. Let's look to see if we can find something better.
Yeah, a little bit down, they have A69.23, arthritis due to Lyme disease. See,
So-
that's where I get confused. So sometimes you just got to keep looking a little bit to make sure there's no
Yeah,
more
just
specific definition.
right, because the higher the number, the higher the money for the diagnosis. So we always want to make sure that we're coding to the most specific as we can. Now we know because we've been doing this for a little while that sometimes it's just a basic code. It doesn't have any extra information and it doesn't match our scenario exactly, but it's still the right code. So I know that it's a bit deceiving. So we just have to, that's what we have to do as coders. We just have to look to make sure that's the most specific thing we can find. So A69.23, arthritis due to Lyme disease. So that is our correct code. All right, so here we have post-traumatic acute headache. So what's our key term?
Headache.
What do we? Headache, right. So we're going to go to headache. Then under headache, we're going to look for post-traumatic. And it's even going to get so specific as under post-traumatic, it's going to say acute. So this one just follows. Hey, we love those stair-step ones that are so easy that it brings us right to, but doesn't always work that way.
No, it doesn't.
That's just experience and practice, Chase, is all it is. So
Well, yeah, because I kicked myself last night because it said cancer of the breast, and I was on the verge of realizing that, see, there's two of them, so it's lateral, right? So you have to actually label which is which, and if it don't say which is which, you do as unspecified. So I'm missing things that I know, so I'm kicking myself after.
you're second guessing yourself. Now, are you using your Neoplasm table or are you using the index?
Neoplasm. But cancers are more, they have a little bit more to them than the other ones do.
Yeah.
Because you need to know if it's primary, then you need to know if it's malignant or if it's just
Benign, specified, unspecified. Yes, I know.
on site. Yeah.
In situ. And we'll learn more about that, but yeah, in situ. So 443 319. Hi,
Hi.
Dana. Guys, this is a new student, and bless her heart, she hasn't even gotten her manuals yet. Dana, I'm still waiting on them to get back with me.
It's okay.
I'm so sorry, but you can follow along with what we're doing, especially when we're talking about, what is the main term we're going to look up. So, okay, so G44319, what does that say, Jenny?
Says acute post-traumatic headache, not intractable.
Okay, so but right underneath that, not intractable, in little bitty letters, what does it say? Acute post-traumatic headache, not otherwise specified. So that little parenthetical note, that note is important because it's telling you, if you don't know what non-retractable is, you don't have to worry about it, because right underneath it says exactly what our scenario says. So we're going to use G44.319. Okay. All right. So let's go to our next one. Okay. Acute superlative otis media without rupture of the eardrum of the left ear. Okay, so I want to say something. When you see these scenarios and they have lots of words, I don't want you to get scared. I don't want you to get scared, okay? Because all of this is just one code, Chase, just one. So we're going to go to in our index. What do you think we're going to go to in our index?
What was it again? Can you read it again?
Oh, do I not have y'all, I don't have my screen shared. Why didn't you tell me? You know I'm crazy sometimes. Doggone it. Hang on. Let me just show y'all these slides that I worked really, really hard to do and didn't even show you. So this is the arthritis one. That was number 1. This was number 2. See how cute they are? And I wasn't even showing them. My goodness. Acute superlative otis media without rupture of eardrum of the left ear.
Did you look up rupture?
No. Now, I'm going to tell you what happens if you look up the wrong word and you can't find what you need. Do you just quit? Kick the can. I'm done. No, you pick a different word. Practice makes perfect. The more that you practice, the more you're going to be able to pick out the term. It's actually otis. I looked up media first. I'm going to be transparent. I do not always pick the right word first, but because I pre-coded these and I mapped them out, I was able to be a little more specific. So we're going to go to otis in our index. And then we just follow the steps. Otis, media, superlative, acute with rupture of eardrum.
Without.
Oh, shoot. Well, now I've got to check my code because maybe Chase is going to call me out today because I may have made a mistake.
Hey, I make a lot of mistakes.
Well,
But that's part of learning.
Yeah, since I'm an instructor, am I supposed to be perfect all the time?
Heck no.
No way, Jose, because none of us are, right?
That's right.
We only learn when we make mistakes. If we get it right all the time, then we don't learn. Oh, and I want to point out, you need to pay attention to the red dots. That's our stop sign. Can't use this code. Must go further down. Yeah, I got the right code on my answer, but I didn't get the. Okay, Melinda, have you found something?
Did we lose Melinda?
Melinda. I don't know where she is. And I can't ask you, Chase, because you're just watching because you're at work. I understand. I'm just glad to see you.
I almost brought my book today. I have everything labeled except for the index so far.
Wonderful. Well, yeah, if you're going to come to class from now on, bring that manual. So on lunch break, you can actually see what we're doing. Please.
Yeah.
Okay, Jenny, what do you see?
Okay, yeah, I found it in the index.
Okay, so what did you find in the index? What do you think?
Says otis media, then it says non-suppurative, but then it says suppurative right under acute with rupture of eardrum, H66.01.
Okay, we need without. I'm sorry, I made a typo. We're looking at without. So do you see one?
Oh, without?
Mm-hmm. I think that's going to be one above.
So would it be the non-suppurative?
No, it's the superlative.
But
it's acute.
without,
but without the rupture. I made a typo. This should be without rupture.
Yeah, those say with rupture of eardrum.
Oh, let me see. All right, well, since I made this mistake, let's just go, it's actually 866.00. So let's go to our H's. So on page 877.
So would it be H66.001?
Okay, so let's look at, we're going to use this one right here. We were using this with rupture, then yes, but look, what's the one without rupture? And H66.001, that's the right eardrum. We're looking for the left ear.
Oh yeah, I don't know why I was thinking right.
Hey, that's okay. I've made mistakes all over the place on this one, but we're figuring it out. So
So without spontaneous rupture, right?
yes, of the left ear.
Okay, so it'd be H66.002.
Yes. Yes. H600.002. I want to put extra decimals. Okay, so this, and if you guys look on your test, I actually it actually says 2 codes. Hang on just one moment, please. I'm sorry, my teenager was running through the house and making lots of noise, so I had to go yell. He was headed to work, so he didn't even know what was going on. I was doing a Zoom, but then he forgot his shoes. So, you know, I guess we lost Dana, bless her heart. Okay, so then we're going to have 2 codes: malignant hypertension with stage 4 chronic kidney disease. So we need 2 codes. So number 1 code is going to be our hypertension. So it's really, really hard for me when, as a coder, from my coding training, like you were saying, Chase, what goes first? Sometimes what they say goes first, I don't necessarily agree with. But here's the upside. When you do your exam, if you put it out of order, because remember, when you guys, once you do your coding exams, I have to go back in and look. So don't ever get freaked out over your grade, because I'm going to go back and regrade it. Because unless you do it exactly the way it's put in there, it marks it wrong. But if you put something first that should be second, I don't mark it wrong. When you get to your facilities and when you get your coding job, you're going to get more training and it will be more specific for you. Right now, it's just learning how to find those codes. So hypertension. So the first code is going to be hypertension. And then we're going to go to kidney, because this is a hypertension with kidney disease. So we go hypertension, kidney. And then it even goes further and says with stage 1 through 4 kidney disease. This one was a long one. I had to really, really take my time and, you know, go through it.
So is it the I13.0?
I 13.0. I got I 12.9. Let me double check. I could be wrong. Let me check. Oh, and you were looking at what? I 13.
On page 292. Like toward the top left.
292. I'm wrestling with my book. Hang on. Here I come.
Oh no, I see what I did. I think it's with heart and kidney, that one.
292. Hypertension, kidney with stage 1 through stage 4 chronic kidney disease. And I have I 12.9.
Yeah, I see it.
Okay. All right, before we move on to check it in our tabular, let's go ahead and look at our second. We have to code the kidney disease. It feels like double coding, doesn't it?
Yeah.
But
This is where I get confused because I'm not sure if, since I already coded that, should I recode the kidney disease?
well, malignant hypertension with stage 4 chronic kidney disease. If we got into the science of it, it probably has a lot to do with what this is. But because I told you there's 2 codes, you know that there's another code. And the only thing that makes sense is to go ahead and do the chronic kidney disease. So to me, it's double coding, but there's probably some little medical term or medical definition that makes it separate too. So if we take away the hypertension, if we take away the malignant hypertension, would we still have chronic kidney disease stage 4?
Yes.
Yes, we would.
Yeah.
So that's kind of, you kind of have to really ask yourself questions. But the easiest way right now is just if I tell you there's 2 codes. So we would go to disease, then kidney, stage 4.
Is it in 18.4?
It is. And just for the sake of time, these are the correct codes. I 21.9, N 18.4. I want you to keep in mind that kidney disease is always in the N's. Diabetes is always in the E's. I'm telling you that for a reason. Remember when I told y'all when we first started, if you remember some of these, like, for example, cancers start in the C-section, right? Because C for cancer, and neoplasms are cancer. So I'm going to show you by the end of this video where this is going to really help. So let's see what we've got. All right, this is the last one that we're going to map out together. So it's encounter for screening for HIV due to high risk heterosexual behavior. And it's 2 codes. So remember when I told you guys that if you see encounter, you should go to encounter, or examination, go to examination? Well, I was very disappointed that this didn't work out for me that way in my index. I had to go to screening. So you go to screening and you're going to go to HIV or immunodeficiency virus. I know I didn't get all those words right, but that's where you're going to find that in your index. And I'm going to tell you guys now, if you, and I've said it before, if you go into your Z codes and you label encounter for blah, HIV encounter and screening, just the ones that you would use the most, you're not going to have to go through all of this for Z codes. Label your Z codes. To me, they're the most difficult ones to find. Although this time around I've gotten better. All right. Screening for HIV. Have you found it, Jenny? It's okay. Melinda, are you with us?
Yes, I'm here. I'm listening, just getting ready for work.
Oh, okay. All right. I just wanted to make sure you were okay.
Yeah, I'm listening.
Is it making sense to you?
Yes, and then after work, I'm gonna come back and do it again with the steps that you're going through right now.
Okay. That sounds great, Melinda. That sounds
Yeah.
great. All right. So Jenny, what did you find for screening HIV?
Says encounter for screening for human immunodeficiency virus.
Mm-hmm.
So that would be the right one.
Did you go to encounter or did you go to screening?
I went to the code D11.4.
Oh, okay. Yeah. I'm sorry. I was still in the index. That's absolutely, yeah, that's right. So what is the second?
So in the index, would I go to encounter?
No, you would go to screening.
Okay.
That's what I was saying. This was I went to encounter and I couldn't find what I needed. And then I just went to screening and it was right there. So so what is our second code? High risk heterosexual behavior. So you're thinking in your head, where would I find that weird diagnosis? In the Z codes every single time. It has all those different things. So I went to high, then risk, and then sexual behavior, heterosexual.
Yeah, today. Sorry.
Oh, we lost Chase.
Okay, the Z72.51 in the tabular says high risk for heterosexual behavior.
Yes, and that's correct. That is correct. So I think, all right, let's go. We're going to do it on our own now. So we're going to cold code what I call, doing these scenarios, just, the two of us just practicing. So infectious colitis. So what do you think we would look up in our index?
Colitis?
That's what I think too. I'm going to go there first. And I'm sorry, I feel like I have my back to you, but I have my book on the table over here.
Okay. Okay. Under colitis, it says C, enteritis infectious.
So cool.
So will we go to infectious, right?
Yeah, we would go to enteritis and then under enteritis, infectious. So see how it's not giving us a code, but it's mapping us where we need to go. It's telling us to go to enteritis, infectious.
It's enteritis infectious, not other specified. A09.
Yep, A09. Let's check and see. If you want me to, I'll just go to the tabular and read what A09 says so you don't have to lose your place.
Okay.
Teamwork, teamwork. A09, infectious gastroenteritis and colitis, unspecified.
So A09 would be the correct
Yes.
code.
Yeah, I'm looking under the excludes and it says, colitis not otherwise specified is excluded in this, but there's one word that makes it different. It's infectious. Because it's infectious, it's A09.
Okay.
So I know you didn't.
Yeah,
look at
sometimes I get confused by the excludes notes too, because they'll say something, but it's like a little different.
Yeah. But the more we practice, so we're going to get there. Okay. Automycosis due to aspergillus. Aspergillosis. Okay. So I think we should go. Well, I'm going to let you tell me. Where do you think we should go?
The automycosis.
Yes. That's what I think too. Let's see if we're right. Because I do not pick perfect every time.
So it says automycosis, not elsewhere classified. Then it says in right underneath, and then aspergillosis, B4489.
That's what I have, but let me go and I will look in the tabular for that. B44.89. So B44 has a red dot, a stop sign, which is aspergillosis. And then if we look at B44.89, it says other forms of aspergillosis. And that is our answer. Because it
So
doesn't.
sometimes it won't say due to, because on the, like when it says right here, it says due to, but this says in. So sometimes it'll be a little different.
Yeah, sometimes it's going to be a little bit different. So when you're looking up your code or when you go to your tabular, if you see due to any, just kind of, I grew up, everybody always said, when you read your Bible, you read the verse above and below. When you're doing your coding, look at what's above and what's below. So that way you can make sure. All right, so the next one is benign neoplasm of the thymus. Have you used your neoplasm table yet?
A little bit. I know I get confused about the like malignant, the primary. I get confused about which one should be used.
Yeah. So let's try our neoplasm table. It starts on page 479, and we're going to look for thymus, Thymus. So we're just going to go to the T's, and we see the T. We see sort of like in a dictionary or encyclopedia at the top, it says table of neoplasms, and then where I'm at on 483, it says brain. So we just look for the alphabet. So we're looking for thymus. We're looking for the T's. Because if you start trying to go down, just looking at what's there, it gets confusing. So I just always look at the top. So TAP. THY.
So that would be the brain.
So it's the thymus and the brain.
Not sure.
No, look on page 504. And go down with your finger until you see thymus. It's towards the end, not at the end, but
Okay,
you see it, thymus?
yeah, I
It's
found it. It
gland.
says gland in parentheses.
Yes, and it says
Okay.
benign, so thymus gland, so benign is the, like the light yellow. So coming down,
D15.0.
yes, that's what I have too. So I'm gonna go check. D15.0. Benign neoplasm of the thymus. It's on page 724.
Okay, yeah, so that's the right code.
That's the correct code. See, that was easy using it that time, the neoplasm table, but I do
Yeah.
know that sometimes it gets a little bit more complicated than that. So bisfacular block is our next one. So what do you think we should look up? I don't
Block?
know. That's what I thought too. So let's go to block first. Well, that
Says
was easy.
I-fiscular, yeah, says cardiac in parentheses
Uh-huh.
and I-45.2.
Yep, and it's on page 135. So let's go to our tabular. I-45.2. Page 901.
Yeah.
Says
So that would be the right code.
that would be the right code. All right. Sick sinusitis syndrome.
Syndrome?
That's where I'm going to go to.
There's I-49.5.
Okay. What page did you find that on?
445.
Okay, that's where I'm at. And you went to sick sinusitis or sinusitis?
I went to syndrome and then down is sick and then indented a little more to the right, there's cell, but then under that there's sinus.
Sinus. Exactly. That's where I'm at too. So I-49.5. So go back and check that. Because we always code two ways, no matter how much of a pain it can be when you're wrestling with this book, but it's on page 902.
Yeah, so it says sick sinus syndrome, so that would be the right code.
Yep. I-49.5. So we knocked these out of the ballpark very, very quickly.
Yeah, it's getting easier. I'm starting to understand now.
So are you ready for a challenge?
Yeah.
So when you see this, how does it make you feel?
A little nervous.
A little nervous. Okay. Well, I want to shed some light on it. So we are only doing diagnoses. We're not doing procedures. So
Okay.
when we look on our record of operation, the pre-operation diagnosis is acute myocardial infarction, congestive heart failure with hypotension. Post-operative diagnoses are the same. We don't need any of this to code ICD-10. Now, if we were coding a procedure, we would need insertion of a Swan-Gonza catheter. But right now, we don't need any of that. So right now, we have diagnoses for acute myocardial infarction, I believe there's 3. I'm trying to get to my paper. Congestive heart failure and hypotension. Well, and the reason that you code the hypotension because congestive heart failure with hypotension. So, but I'm going to tell you, usually the acute myocardial infarction and the congestive heart failure in real world coding, that's like the only 2 codes that you would need to get paid, but I'm teaching you to code everything. So let's break it down. So how do we code acute myocardial infarction? Well, we're going to go to what?
Infarction.
Infarction. So let's go to our index in the eyes and find infarction. And yes, I know it's a funny word. It means heart attack. Myocardial infarction is a heart attack.
Okay. Says myocardial acute with stated duration of 4 weeks or less. So will we use that code or no?
Okay, I'm still looking. You're so fast. So
It's on page 301.
yeah, I'm there. I just so it's myocardial, which is heart.
Mhm.
Okay, when I go to heart, it says C, infarct, myocardium. So now I'm going to look for myocardium. I see.
It's under the muscle on the top left 301.
Yes, that's right. I2 1.9.
So even though it says duration of 4 weeks or less, we still use it.
Yeah. Yeah, it does, if it's 4 weeks or less, which means it could be today.
Okay.
So our next one is going to be congestive heart failure. So what word do we need to look up there?
Failure.
Very good. Yes, Jenny, failure. I need you to slow down. This old woman can't keep up with you. Heart. Did you find it?
Yeah. I50.9.
Yep. And then hypotension is our next one. So of course we would go, oh, well, we don't have to go look that up in the tabular because I know the answer's right. So we'll just stick with it. So the next one is going to be hypotension.
I-95.9.
Yep. So, and I know we're supposed to code two ways and look in the tabular, but I've already coded these. So the answer is correct. It's I-21.9, I-509, and I-95.9. So we have a lot of heart in the section of the I's, the letter I. So that's pretty good, just to remember that. Okay. So where did I put that? Hang on a minute. Let me find that slide. Where did I put that? Okay. So this is a example straight out of your NCCT certification exam. So this is what it looks like, except it's electronic and you can click which one you want. But let's take a look at this. The patient is here today for a weekly chemotherapy treatment for metastatic neoplasm in the descending colon. At this time, the origin of the primary neoplasm is unknown. Which of the following is the correct code assessment? So we have to choose A, B, C, or D. Now, what I do just naturally, I'm gonna see if I can put words into this. I look to see how many codes have the same code in them. Like, look at A and B. A and B have the same codes, they're just matched, just switched around. Okay, the same thing for C and D, the same code, just switched around. So let's look at our first codes to see if that lines up. So let's look at C, and we don't have to go to our neoplasm table because it already gives us the C 801.
C801 says malignant primary neoplasm unspecified.
Well, but it's specified because it says of the colon, right?
Yeah.
Let's look at C78.5. Secondary neoplasm of the large intestine and rectum. Descending colon is that bottom part of your colon that actually goes to your rectum.
Yeah.
So I like that code, but I'm not convinced. Let's look at C79.9. See, that says secondary. We can't have a secondary code start first. So 79.9 is not it. So let's look at C18.6.
Says malignant neoplasm of descending colon.
Okay. Malignant neoplasm of descending colon. All right, so now we like C. C18.6. Now we need to look at that second code to make sure that we're right. So C79.9.
The secondary malignant neoplasm of unspecified site.
So that cannot be right because that second code isn't right because it is specified, right?
Yeah.
So we liked C79.9. Let's look at C18.6. We already looked at that. Oh my goodness.
Yeah. It's different order, but same codes.
Yeah, but that was right, correct?
Yeah.
So I think C. Let's see if we're right. C 78.5, C 80.1. Okay, that's what it says. I want to challenge that. Let me take a look again. Let's look again and see if we can see where that's going. So C 78.5. Secondary. That can't be right. No, I'm sticking with C is correct.
Okay. Yeah, that's the
what
one that makes the sense to me.
Yeah, C is correct. So, okay, I'm going to give you a tip. Diabetes are in the E codes, and kidney disease is in the N section. Diabetes, E, kidney, N. Diabetes is the endocrine system, which means diabetes. Which of the following ICD-10-CM codes should be assigned for type 2 diabetes mellitus due to underlying condition with diabetic chronic stage 3 kidney disease? Okay, this is why I kept saying that today. So by process of elimination, I know what code this is. So let's see, we have type 2 diabetes mellitus due to an underlying condition, which is chronic kidney disease. So answer B, let's look at it. Even without going to our book, E11.22, that's a diabetic code right there, right? Because it starts with the E. N18.3 is a kidney disease code. We don't have to go any further because by process of elimination and just knowing what section we're supposed to be in makes us right. Does that make sense?
Yeah, I remember some of those from doing all the practice on the theories and stuff. Yeah, I do remember that. I know E11, the diabetic code for sure.
Yeah, E11.9, I think is type 1 diabetes, just basic. So yeah, I put the answer there for some reason, can't see it. So the next thing that we're going to do is we're just going to do a quick little review on the medical terms that I gave last week, but we're only going to do 1 through 10 and just kind of go over them. And then next week I won't be here. There's a pre-recorded lecture. So the next week we'll get back on task with them. So abrasion is a cut or a scrape that typically isn't serious. Abscess is a tender fluid-filled pocket that forms in tissue, usually due to an infection. Acute signifies a condition that begins abruptly and is sometimes severe, but the duration is short. Remember what I say about acute, boy? Comes on quick, leaves fast, you know. Benign means not cancerous. Biopsy is a small sample of tissue that's taken for testing. Chronic signifies a reoccurring, persistent condition like heart disease. A contusion is a bruise. Excuse me, I got choked. A defibrillator is a medical device that uses electric shocks to restore normal heartbeat. Edema is swelling caused by fluid accumulation. And an embolism is an arterial blockage, often caused by a blood clot. I really think that most people know what these mean, but I just want us to make sure we're familiar. I don't know if you remember, but we have 14. So we're just going to keep going over them and over them and over them until we know them and until y'all say, Miss Marcia, don't tell me anymore. That's all.
It's getting easier. I feel more confident. Like I said,